In the wake of former President Joe Biden's recent prostate cancer diagnosis, many men and their families are taking a closer look at their own health. Prostate cancer, one of the most common cancers in men, with about 1 in 8 diagnosed in their lifetime. It is most frequently found in men over the age of 65, but good news, when it's detected early, it is highly treatable. Joining us this morning to shed lights on the signs, the symptoms, and the advanced treatment options here in our region is Dr. Eric Scofield, who's a medical oncologist with Novant Health. Thank you for being here this morning.
Oh, thank you.
First things first, again, it's raising public awareness. What's the one thing that people really need to know about this right now this morning?
Well, let's start with, what is the prostate gland? It's a male reproductive organ about the size of a walnut that sits just below the bladder. And prostate cancer is when some of the cells of the gland grow abnormally. And most men don't even know they have it, right? So a lot of cases are actually found on autopsy in most men. That's why we know it's a lot more prevalent than what we're actually detecting.
Well, you bring up a very good point. A lot of men are dying with prostate cancer and don't even realize it. Let's talk about just getting routine screenings for this. Is that more and more common, or it's the symptoms that finally bring people to the doctor?
So most men are diagnosed in an asymptomatic state because of modern screening techniques.
And what are some of those screening techniques?
So the most common that we use in the modern age is the PSA, which is a laboratory test known as the prostate-specific antigen. We used to do a lot of exams called digital rectal exams, but most expert groups don't recommend that anymore.
And I'm trying to remember, because I've been doing this a long time, I remember some of these stories. At one time there was some freezing technique to kind of treat this. Am I correct there?
I think you're thinking of cryoablation.
Yeah, And so what are some of the options now for treatment?
So cryoablation is a type of localized therapy for prostate cancer, and that's in a very small percentage of people that's even an option. There's also ultrasound techniques they can do, but in more advanced stages or more high-risk cases, they can use robotic surgeries, they can use radiation, and a lot of times we'll use hormone blockers, testosterone blockers, as a way to sort of starve the cancer out. And depending on which stage you're diagnosed at, sometimes that can be as long as 6 months that you have to suppress testosterone, or it can go as long as 2 years or even longer if you have a more advanced stage.
And so a lot of men are very concerned because this affects quality of life in several instances. Has that improved over the years now with some of these treatment techniques, or no?
So a lot of the quality of life issues has to do with blocking testosterone, right? The hot flashes, the muscle weakness, the bone density loss. Those are always going to be the side effects, and some men are more sensitive to to the shifts in testosterone than other men, but that's kind of the big thing, with prostate cancer treatments, and there's not a lot of ways to get around it.
And very quickly, the president, an elderly gentleman in his 80s, some talk about when I should really start to be screened for this. Best advice for folks would be what?
So most people, you want to start screening at the age of 50, and this is a discussion with your primary care provider. In certain cases, people that are a higher risk for prostate cancer, you can start screening as early as 40.
All right, doctor, thank you for the information.
Thank you.